Hi, I'm Cheryl Kramer Kaye, the Executive Beauty Director for Shape Magazine. You know, over the years, my readers have asked me so many questions about BOTOX Cosmetic. And now, through this 3-part video series, I'm going to answer those questions based on my personal experience. I'm not only someone who has been treated with BOTOX Cosmetic for these deep lines here, I also write about BOTOX Cosmetic for my job. The first time I went to the doctor for BOTOX Cosmetic, it had just been approved and I wanted to write a story about it. And I was also really starting to notice my frown lines. So much has changed in my life since I wrote that first story about BOTOX Cosmetic. I got married, I changed jobs, I had twins, and now I am juggling the life of a working mother. And it's sometimes really hard to find time for me in there. But the one thing I will always make time for is BOTOX Cosmetic. And the fact is, it doesn't take a lot of time out of my schedule. It's just a quick trip to the doctor, and let me tell you, it is worth the $15 extra for the babysitter. Over the years, when the lines come back, I can barely stand it. And I go to the doctor and get treated again, and I've really come to appreciate what BOTOX Cosmetic can do for me. As a beauty director, it's my job to be informed and objective about the treatments and products that are out there. And when I first started writing about BOTOX Cosmetic, I did my homework. I went to the experts, the dermatologists. I was absolutely blown away by what the dermatologists were showing. They had before and after pictures of frown lines, and the difference was amazing. And I thought, this is something that my readers need to know about. Over the years, many of my readers have told me how happy they are and the real results that they get with BOTOX Cosmetic. In my job, I see a lot of products, I hear a lot of promises, but the fact is, BOTOX Cosmetic has the science behind it to really do the job. So as you can see, these frown lines are back. They are deeper and I cannot stand it. So I'm heading back to my doctor for another treatment of BOTOX Cosmetic. So this time, I'm also going to ask my doctor about BOTOX Cosmetic for my crow's feet, because these things have gotten a lot worse. So now it's time for me to go see my doctor for a treatment of BOTOX Cosmetic. And in the next video, you will find me at the doctor. Maybe it's time for you to find a doctor and consider BOTOX Cosmetic. You can find one at botoxcosmetic.com. In my role as beauty director, I've become very knowledgeable about a lot of products, and so people are asking me about them all the time. My friends ask me at lunch, my coworkers corner me in the ladies' room, mommies ask me on play dates, and one of the things they ask me most often about is BOTOX Cosmetic. I get asked all kinds of questions about BOTOX Cosmetic.
Is it gonna look fake? Does it hurt?
Am I ready for BOTOX Cosmetic?
The best person to answer your questions about BOTOX Cosmetic is a doctor. So here we are at my doctor's office, Dr. Doris Day, and we're going to get your questions answered. Oh, Dr. Day, it is so good to see you. Can you believe that it has been 12 years since I came to see you for my first BOTOX Cosmetic treatment to treat those bad lines between my brows?
Where's the time gone?
I can't even imagine. I've been doing BOTOX Cosmetic treatments all along, but now, of course, the lines are back, they come back. But I also wanted to talk to you about treating my crow's feet. They've been getting a lot more noticeable lately.
BOTOX Cosmetic is the only FDA-approved treatment for the lateral canthal lines that are moderate to severe, and we know those as crow's feet lines, and they can become deeper over time. You're a perfect candidate for the treatment.
So in addition to my treatment, I have so many questions from my readers about BOTOX Cosmetic that I want to ask you because you're the expert.
After BOTOX Cosmetic, is it still possible for me to make expressions?
That's a great question, and the short answer is yes. In my experience, BOTOX Cosmetic is very precise and predictable, and when administered properly, it really does soften the lines between your eyes, allowing you to be expressive, but still look like yourself.
How do I find a good injector?
BOTOX Cosmetic is a technique-sensitive treatment, and it's so important to find a trained aesthetic physician who understands facial anatomy.
I totally agree. I get asked this question a lot, and what I always tell people is The more experienced the injector, the better.
Is it only for celebrities and socialites?
I think that's probably one of the biggest misconceptions about Botox Cosmetic. In my office, I see everybody from the secretary to the CEO on a daily basis. Any more questions from your readers before we start?
Am I ready for Botox Cosmetic?
I get that question in my practice every day. Patients coming in and asking if it's the right time for them to have a Botox Cosmetic treatment. And the way that I tell my patients is that you'll know when you're ready. You'll notice the lines getting deeper and it starts to bother you more.
Honestly, is it worth it?
I think I'm gonna take this one.
Okay.
For me, absolutely. You know, it doesn't take a lot of time, it costs a lot less than I thought it would, and I only have to come to your office a few times a year to treat these frown lines.
Absolutely true. I get that. All right, so let's start. You ready?
I'm ready.
Okay. So just relax. It's a little pinch. Common side effects include localized pain, infection, inflammation, tenderness, swelling, redness, bleeding, and bruising. All right, we're all done. You did great. In my experience, you may start to see results in a few days, and you'll have optimal results in about 30 days.
Hi, I'm Cheryl Kramer Kaye, Shape Magazine's beauty director, and I was treated with BOTOX Cosmetic. I went to see Dr. Doris Day, and she did my deeper frown lines that came back again and drive me nuts. And for the first time, she did my crow's feet, which were starting to get a lot more noticeable. And here we are with the results. Voila! I am very pleased. Results like these are just one of the reasons I see my doctor for BOTOX Cosmetic. And in this video, I'll share more reasons that I am such a fan of this treatment. Reason number one, it's quick. I mean, my days are packed. I have work meetings and events and of course my family. But when the time comes, I make an appointment with my doctor and I can stop by for BOTOX Cosmetic on my way home from work and still make it home for the boys' bath time. Reason number two, it works, really. I use lots of products, but the fact is, I'm kind of impatient when it comes to seeing results. And with BOTOX Cosmetic, I really see those results. In about a week, I start to see those deeper lines smoothing out, and that is the kind of quick gratification I am looking for. Reason number three, it's still me. The thing about BOTOX Cosmetic is that it's a tweak, not a total overhaul. I like the way I look. What I don't like though is those deepening lines between my brows and around my eyes. And with BOTOX Cosmetic, I look in the mirror and it's still me. Listen, if I didn't tell anyone that I'm treated with BOTOX Cosmetic, they wouldn't know. The results are that subtle. But you know me, when I find a product that works, I want to tell everyone like I'm telling you right now. Reason number four, I can still make expressions. Listen, I am an expressive person and I need to make these silly faces with my kids. With BOTOX Cosmetic, I can still do that. So those are my reasons. What are your reasons for not seeing a doctor for BOTOX Cosmetic? What are you waiting for? Find one at BOTOXcosmetic.com. Thank you so much for watching and letting me share my story with you.
BOTOX Cosmetic, onabotulinum toxin A, important information. Approved uses. BOTOX Cosmetic is a prescription medicine that is injected into muscles and used to temporarily improve the look of both moderate to severe crow's feet lines and frown lines between the eyebrows in adults. Important safety information. BOTOX Cosmetic may cause serious side effects that can be life-threatening. Call your doctor or get medical help right away if you have any of these problems anytime, hours to weeks after injection of BOTOX Cosmetic. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms, including loss of strength and all-over muscle weakness, double vision, blurred vision, and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. If this happens, do not drive a car, operate machinery, or do other dangerous activities. The dose of BOTOX Cosmetic is not the same as or comparable to any other botulinum toxin product. There has not been a confirmed serious case of spread of toxin effect when BOTOX Cosmetic has been used at the recommended dose to treat frown lines, crow's feet lines, or both at the same time. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Tell your doctor or get medical help right away if you are wheezing or have asthma symptoms, or if you become dizzy or faint. Do not take BOTOX Cosmetic if you are allergic to any of the ingredients in BOTOX Cosmetic. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myoblock, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A, have a skin infection at the planned injection site. Tell your doctor about all your muscle or nerve conditions, such as amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of BOTOX Cosmetic. Tell your doctor about all your medical conditions, including plans to have surgery, had surgery on your face, weakness of forehead muscles, such as trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if BOTOX Cosmetic can harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if BOTOX Cosmetic passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using BOTOX Cosmetic with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received BOTOX Cosmetic in the past. Especially tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myoblock, Dysport, or Xeomin in the past. Be sure your doctor knows exactly which product you received. Have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of BOTOX Cosmetic include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. To report a side effect, please call Allergan at 1-800-433-8871. Please see BOTOX Cosmetic full product information, including boxed warning and medication guide, on this website.